So just I'm going to start from the top, and I kind of want to give you a visual of buckets, right? Inside of my app, it's like these buckets. You pour a bucket in the top there, and the stuff flows out of that bucket into the next bucket, into subsequent. All the buckets are flow into each other. That's the way that I kind of wanted my system to be set up. And so at the top level, this is basically like the first level, but this is user centric. Depending on if you're a clinician or provider, whatever the case may be, mainly we also have CRM business development folks in here as well. You all will have a little different of a page, mostly the same, but this gives you the ability to track mileage and expenses. When you are onboarding a new person into the clinic, you'll be able to just give them one login. They'll have all of their policies, all their training materials. They'll have access to industry news, and then they'll also have access to the support team right from inside of the app. When you look at like our HR hub, we've created a system where we know that the lifeblood of wound care, or any business for that sake, is for anything of that, you want to be able to communicate with your team. You want to be able to track who credentials are good, and being able to track whose credentials are valid and so forth. And so this is what this does. This gives HR an ability to basically onboard all of their providers, collect all the information that's needed to authenticate their ability to access the Instant RX communication widget, pharmacy management, all of your education bundles. Everything that you need is all right here in one bundle for that HR person to manage all of your logs. Everything rolls up to right here in your credential tracker. You can come in here, you can put down the role, and then you can upload that information. The system will warn you when that is expiring, and then it'll also, if it expires, then it'll also prevent that provider from seeing patients, so that you don't run into any issues there. The next bucket that flows downward is really the bucket of business development or marketing, because that's really a part of the lifeblood of a
It
facility.
is.
Go ahead.
It's me. Yes, it is.
What we've done is I went out and I created a business development CRM that's designed just for wound care. So what it does is in the background, it's tracking all of your referral sources, and it's saying, well, hey, look, this referral source is a new practice, so you should add them to your route for today. It'll also analyze to see if you have facilities that were sending you, let's say 50 referrals 3 months ago, and then the next month they sent you 30, and now they're on pace to send you 20. It's basically tracking that, and it's saying, hey, look, you need to go check up and find out what's going on with those folks. And then you can add that to the route, right? And then what it also allows for you to do while you're in the system and you want to log the information that happens on those visits, you can easily do that by clicking there. If you go out and let's say you buy donuts or you buy lunch for the team, you can add that spend right here. And this will basically allow for you to search for that clinic. And then by adding this clinic, the amount of money that you spent for them that day, now you're able to get a clear view, add your receipt. Everything stays nice and clean for your BD team. And you're able to now go in, have the receipt, not have to worry about following up with people at the end of the month to get all those receipts. But the beautiful part of this is that you're able to track the ROI. So you're able to see the ROI of each and every person that you're basically doing outreach to, right? You can see how this connects all of their referrals inside the CRM. So you're basically seeing how much money they're generating month to date. And then we take that number, which comes from the graphs and from the back end, and then it calculates how much you've spent and, working with them. So you can get an idea of who you should still be reaching out to, who you shouldn't. If you have somebody who keeps going out and they're doing a lot of activity, but that person's not sending any new referrals, and it's like, okay, why are we still doing this, right? And it gives the management team more clarity to exactly what's going on a per clinic level. In here as well, you can dig down a little deeper. This is what you basically get when you go into the actual clinic view. You can call, you can click the map to go to the visit, you can click notes to add notes, but you can also see all of the different activity that's been done, whether it's call, visits, notes, voice notes, spend, log activity, everything that's gone on all of the documents. If you have any documents that you needed to be filled out and signed or procured through that relationship, you can do all of that there and have it housed so the team can reference it later. Now from there, the next bucket that gets poured in, if you're doing a really good job in your CRM, the next thing is the referrals that are sent by these referral sources. And then when these referral sources come in, you're going to have this what's called a Kanban board that allows for you to manage the whole entire workflow, what I call the pre-patient workflow. Once that referral comes in, you're able to go into our referral intake system and you're able to enter all the pertinent information. And then from there, you're also able to validate the insurance in real time by putting the insurance provider, the policy number, the group number, so on and so on. And our system will validate that insurance. So you don't have to have a team member that, or offshore folks going in and doing all that verification stuff for you. It's done right in the system. On this system, on this Kanban board, you'll notice that you can basically just move these patients around. So if you're waiting for information from the PCP or the home health, you put it here because now you're waiting for information. If you get to the point where you're submitting this information for billing and authorization, you come here. We have an authorization piece of this puzzle as well. Of course, you do the verification, and then you have authorizations that you can send out through the system via PDF, via email, or whether fax. We have a smart fax system embedded in the system. You can also do the request authorization. Once that is approved, you can come back, click approved, and then this verified button appears in the right-hand corner. Now the team knows that they have the green light to go ahead and put that patient in play. So once that person is ready for assignment, you put them in this category, and then what happens is you click assign. This right here brings up what one of the first things I ever created called the distance matrix.
Where were you 2 years ago?
I created this 2 years. I actually created this about 2 years ago, but it was in beta. So I just perfected it, and now we're rolling it out. So what this does is this looks at the distance and the workload of each provider, and it ranks them for that person who's assigning them. And so all they have to do is pull them up in here, and then they can assign them. And so this is the assignment module, so you can assign them. Now, we have two ways of workflows of managing. Once they're assigned, they can get scheduled from here, or they can get scheduled from inside of the patient management, because this screen right here is what your clinicians will see. So when that new person is assigned, they're going to get this drop down, and they're able to call and do the scheduling, or your referral intake person can do the scheduling from in here. Both of the routes are very clean. So what happens is you click the schedule button. What this does is this looks at all of your routes, all of your days, all of your times, and it will suggest the best place to put that patient in your route. Okay, you can also do it manually if you want. You don't have to, do that, from any other view. You can just say, hey, I want to do it manually. If you don't, you can use the smart suggest that we've built in, the AI that we built in. Now, from there, once you have that assigned, you have it scheduled, you have this patient management screen, and this is where all of at the end of the beginning of the day, the clinicians will come in here. They'll see this map right here with all of the visits, and then down here they'll have the names, the times, the exact times, and ability to change schedule, to do whatever they need to do down here. Once they get to that visit, they get to what's called our all patients or patient area, and this is really kind of where the EHR section is. So what I've done is I've created a system that's a little different from how most EHRs work, where what I've done is I built my system based on this idea or this concept of cockpits, where I put everything you need and nothing you don't. I try to compartmentalize all of this data with colors and schemes so that there's zero friction on the front end when the provider or the clinician comes in and needs to manage all of these things. As you can see, we have a place for wounds. We have a place for your meds, your billing and off, your medical history, the messages, patient timeline, and documents. And underneath, we basically have some of the higher level, more important information, which I deemed more important when I was designing this. I wanted the clinician or the provider to have quick access to wound-specific medications and systemic medications, so that if there's any issues with allergies or reaction, they can always have access to that right away. We also have an ability to build in all of your strategic partners when it comes to home health. You can basically hardwire those individuals by patient into the system. So as you go throughout the clinical workflow, those individuals are there and you can fax them, communicate with them, all from within inside the system. And then you also have the referral information that was sent over, all of your labs and tests, all your surgical history, all this information flows in. And when you look back at the referral intake, we also have another part that I didn't show you yet. This is called our pre-charting. What this does is this allows for you to put the name of that patient and their date of birth in. And then what we do is we pull in all of their medical history, and then that medical history will then push down here to that screen that we were just reviewing under all screens. So right here, all that information will automatically flow into the medical history, the social history, family history, all of that flows in through our Zeus API. Now, one thing that makes us really special is this wound cockpit. What our wound cockpit is, it's an area where we've said that instead of managing the patient, we want to manage wounds. So our system goes in and on the initial visit, the initial evaluation, it creates wound cases and it tracks those wound cases one at a time or individually. And why do we do that? And when I was working with this one clinic, what I found is that they were having a hell of a time going into IntelliCure and figuring out where every wound was at. How many visits has this wound had? Well, we've been visiting this patient now for 7 weeks, and now they have a new wound, right? So when we add that wound, it's still just all clustered. It wasn't like they could go, they had to dig around, look for stuff, had to do manual counting, had to do a lot of copy pasting to do IVR submissions. What we did was we broke all those wounds out, those cases out, and we make it so that now you can update those cases and work in those cases in a siloed view. Or if you're inside of what's called our wizards, you can bring them all in and manage them all together in that environment on the visit. Let me give you an example. So this right here is our wound wizard. This is the intake wizard. And so at the first step, what we do is going back to, there's 2 routes to this. If we have it set up properly, once this card is moved to here, the patient will receive a text message that allows for them to do the consent automatically, okay? Now, by the time that provider goes, if that has not been done, this first screen becomes critical. So what happens is this will pop out, they can do the consent with the patient and then have them sign on the app and then complete patient consent. And now that's done. And now the system gives them the clearance to go ahead with that visit. You can generate a document PDF and you keep going. Now, once you get into there, we have our patient context and demographics. So you can put in here where they at? Are they at SNF? Are they home? As the render provider, you got your rendering provider that would pull in, and then you have your supervising provider. You can pull that in. You can pull in your clinician. Basically, all these other things get pulled in, right? And then you have your location context as well, and I'll explain that to you a little bit. Right here is where your home health agency is automatically being pulled in. So this allows for you to just, again, select that home health agency, and now you have the ability to have them pulled into the context of that patient now. This facility is a little different. So let's just say you are in a SNF or you're at some home health, or not a home health, but a convalescent home or something like that. You can actually pull that facility into there so that the system will know for billing purposes where you did that at and what facility you did it at and the like, okay? The system, after you do that, you have your ROAS. You're able.
Can I ask you a question real quick?
Yeah, go ahead.
Is there a mobile application to this?
This is all mobile. This
We can do this from our phone.
is all designed for mobile first. The only thing, there's a couple screens like your your referral intake.
That stuff is web-based.
Yes, that all of this is web-based, but this is an actual application that goes on your phone.
Okay, all right. Okay.
Yep.
I didn't want to get all excited and be like, we get the info. No, it's not an app. We still do all of this on a computer.
No. The good thing about our app is that we also have offline mode, so you can actually do your note. You can do this whole intake, this whole process of patient management that we're going through right now. You can do it all and it'll save, and then once you get back onto a network, it'll upload to the database. Okay. So here you see we have the ROAS, and you can basically use the voice recorder, and you can say, hey, the patient has fever, night sweats, and put your notes in through voice, and it'll actually populate all of that. Then you can just hit mark complete, and then you can move on. Then you have your objective assessment area. This area, of course, you're collecting all the objective information, your general assessment for all of these different areas. And then you have your gastro-nutritional assessment, which of course is important. And then we also have this nutritional assessment piece of the puzzle, all of your labs and imaging. And I'll explain this to you a little bit. Right here this is probably not the best place for this, but what happens is when you, like, let's just say you send out some labs, you can attach that. And then what'll happen is whenever you go back into the visit wizard, you'll see all of your labs right there in context before you begin your visit. This right here is your comorbidities. And as you can see, what I've done is everything is contextual. So as I click the button, the other part flows out or it's not revealed anymore. And then you're just presented with this new area, which makes it nice and clean. And just, again, it removes all of the resistance that comes into play when your providers are out there and just kind of handling things, and a lot of stuff may be going on. This is your mobility status, the functional status assessment that we have built in. And then from there, we have the wound and the documentation area. Under the wound assessment, this is where we set up all of the wound pertinence things, and you're able to go into the system and you can add a wound, and you just basically select the body part, and then you can also select multiple body parts as well. While you're in here, if the does have multiple wounds, they can, you'll have access to have both of those wounds, and you can treat them at one time. You just switch between both wounds right there. From there, you can basically add all the historical data. You can add your precise location information, and then from here, you have your onset. So we basically collect this information because we have an algorithm in the back end. And so what we want to do is kind of collect the historical measurements from if they have four visits already, we collect that information, and then we have an algorithm in the system that will tell that clinician or that provider that, hey, because of you have this historical measurements and you have these other elements that I'm going to go over subsequently in a second, now that we can tell you with a little bit of confidence that you can submit an IVR right now and maybe even do grafting on the second visit. We build that into the wizard to help guide that clinician or provider. And we also have the camera, and what we do is we use a little dot next to the wound to extract the measurements. So you basically just order these little dots on Amazon. They're like $2 a pack for about 1,000 of them, and then you just put those little dots next to the image. You click the camera, and then this will then pull out your measurements and everything.
Do we have the ability to continue with manual measurements if we want to?
So if you want to, you can just basically manually put your measurements in here, right here. The measurements will pop in there, but you can put your own measurements in there.
Okay.
From there, you also have the ability to add your tunneling and your undermining. We have these two features right here. So all of that is brought in so that you can log that. From there, you have your tissue assessment part of the puzzle that we've been talking about. But what we do is you add all of these components in, and then what we're able to do is we're tracking these things so that you have a clear idea of where everything is at. Okay. And I'll give you a little bit of understanding of that in a second on the other wizard. You're also able to put those previous treatments in. So here under these previous treatments, you can go in, you can enter above. What we did was we added the measurements and the dates of the treatments and the measurements. Down here, we put down those previous treatments, and then what we're doing is we're documenting what was done on those actual visits. Does that make sense?
Yes.
And so if we're able to basically add those information showing that, this conservative treatments were done, then we can use the algorithm to say that this person meets the LCD requirement. It'll also say whether it failed conservative care documentation or whatever. You can upload any supporting documentation. And so we're able to do all of this on that intake wizard. But this information, the subsequent wizards are different because what you're doing is you're updating information on those subsequent visits. This is our treatment section. So what happens is we have like your conservative care, and then Once they have been approved and with an IVR, then what happens is we have this other section below that includes advanced treatments and just advanced treatments that might be performed outside of the scope of conservative. To push those through, you're basically just going to click a button, you're going to put the information in, you're going to take a photo before and after the visit. We have what's called an LCD guardrail in the system, so we're helping the clinician to understand what's very important, just in case you get audited or try to get clawback or something. We're trying to collect doing a good job of collecting all that information on the front end. Our wizards are also inventory aware. We have a built-in ERP, so you're able to add all of your products ahead of time, and you're able to search that product and add that product to the visits. You can also see what products you used, and then it also removes it from your inventory. This right here is the last stage of the care or planning or treatment planning section. And what you have here is your treatment plan, your healing potential information, and your visit frequency. Now, the reason why we keep these three elements in here is because we are trying to get these practices to really understand compliance. Like, a lot of people say, well, why do you have that there? Because if it doesn't have a good healing potential, the prognosis is very poor, then maybe we shouldn't be grafting.
Exactly.
That's exactly the way we feel. Like, you should know that, right? Some people don't want this evidence.
I see. When I'm consulting, it is a nightmare.
It's a nightmare. And so what we're trying to do is help folks understand that, hey, look, if somebody's in hospice, you should not be grafting 100 centimeter, right? You should just stop it.
Grafting at all.
Stop it. You should not be doing any of that, right? You can actually, so that's the reason why we built this in. We've had a couple of like senior folks like, oh, why are we putting this in here? Dude, we don't want the evidence of any. No, I said, use exactly what you want for your team, because you don't want them going off the rails, doing things that are going to make you very suspect and open up what I would call a Pandora's box into looking at everything you've done, right? It's like having a corrupt DE, right? A DA, a corrupt district attorney. You know, if they find one bad thing with one of his cases, now you're going to open up every single case. Now let's look at everything, right? Because what are you doing over here? So that's the reason why we created. Another thing that we have is our free-flowing system, where what we do is we go out, you give us your DME, you give us your lab, your imaging, all of your partners, you give them to us, and we embed their scripts or their forms into our system. So once you come in here, you have a vendor, you can be able to go down, and once you select them, you can add an order onto the system. We're going to bring their form into here, and so your team is going to fill this out, and they'll be able to fax it or email it, or they can download it, and they can do whatever they want with it. But what we do is we try to, if this is the cool thing about our system, if you give us your DME or your labs provider, we build them and we integrate them into your system. So they'll have their own login. So you'll submit a DME or you'll submit a lab, then they'll go to labs, and then they'll see all of your submissions. Then they can go up in here, and they can literally then give you the results inside of Medipyx, and it'll be attached to the patient next time you go back to visit them. So it makes it really smooth, and so that transaction happens like instantly, right? So that's another cool feature in the app. Now, you also have your patient education built into the system. The one thing that you can build this out, you can make your own care bundles, and then you can assign this to the patient. You can email it or you can text it to the patient from within inside the system, and then have the documentation that you've sent that. Now, once you finish your visit, we basically pull all the information in from the visit. And so we see what you've done. The medical code's hardwired to the system, and it's going to be pulling all that information in. And then you can create your compliance note from all of the information. And then we also have an AI agent that helps you to generate the note so that you can then edit it if you want. You can also edit it as well, but it'll guide you. Then you also have a medication. We also have the RX in here as well. So you'll be able to submit your RX right from inside the system and send it to the different pharmacies and so forth. This is your billing and documentation. So after you finish your visit, This wizard will automatically bring in the pertinent CPT codes, the ICD-10 and the HIPAA, and the place of service information. It'll bring that in. The cool thing about this is that we have a hardwired logic with all of the CPT codes, but then we also have an AI validator that will go through the visit, look at it, and then also correct and give you even more suggestions. Now, the reason why we do this is so by the time your clinician leaves the driveway, they have really a billable note at that time, or very close to it. So your team, your billing team, should have no excuse to push this through very quickly, right? To just say, go in there, audit it, make sure that everything is good to go, and then submit it. Now, we also have this thing we call the LCD compliant checklist. I call it our LCD navigator. And what this does, this audits that visit. So it says, hey, look, you're missing this, you're missing that, and it will audit everything and tell you to go back and to update those things as well. And then this is your attestation where you put your information in, provider name, the NPI number, and so on, provider attestation, and then the signature. And then we also have the ability to add the signature on the front end for your clinicians, and then have them basically just stamp that signature into place as well. So this is the intake wizard. Now let me take you through the wizard for the updating of everything. This is what you're going to see once the wound case has been established. Now you're able to go into here, and this also has the LCD compliant status as well. So it breaks it out a little bit more because those subsequent visits are very critical for what we need to do or what we need to analyze for that patient. As you can see, all of this is basically the same, and it's going to flow in from the wound case. The cool thing I want to show you in here is the previous treatments, but let me see something. I want to show you this. So once you fill in the new information, what our system is doing, it's tracking each wound, and all the information that your clinicians and providers put in it's showing you the reduction, what happened to the pain level over time, the exude, and what it's doing is it's giving you can set up those treatment goals, and then it shows you how far along that patient is in every single area. And so again, you got most of this is basically the same, but the cool thing about what we've done is we've made the connection between all the different assessments and all of the treatment work that's being done. So all that information will then flow into here, and so you can get a good idea of the improvement of that wound.
Oh, I just wanted to add here in that section that Damon showed you, Carrie, in the treatment progress goals. There's also part there in which it will give you the percentage of improvement from initial visit. It will also guide you like where you're at if you're planning to graft the patient. If you're more than 50% of improvement, is the patient still graftable or no? So that percentage of improvement calculates from the initial visit.
Okay. So any questions thus far?
So when they're documenting the percentages of tissue, do you have it does it where it has to equal 100%? So to get past that section. I know that seems elementary, but you'd be surprised that when we're out in the field, how our brains quit being able to add percentages of tissue. So you're like, oh, well, it's really like 25%. That's really like, yeah. So, okay, perfect.
So we added a validation in there that tissue presentation is all equivalent to 100. So you can go way more than that. Because I agree with you. I have seen documentations that they put 55% and then 65% on the other part, which is more than 100 already. Yeah.
Exactly. Okay. So So let's see here. So most of this is the same. Now this is our LCD navigator. So this helps you to get to the point where you can actually see what's been done. We went through a few things, and it's able to tell me like, hey, these are incomplete. You need to follow. You need to go back. You need to do these. This is a nice tool for your team to know, what do they need to do to make sure that this is completely filled out, ready to go. So when it's sent to that biller, you're not going to have an issue. Okay. Now, moving on to the next bucket that just pours out into. Well, let me go back to just talk about the inventory section a little bit. So in our system, you're going to have inventory management system built into the platform. We hate to I don't really call it the EHR. I actually call it the first healthcare OS because it's an operating system, because it basically is connecting everything that you need. And so when you're able to come in, you're able to come into here, go into advanced treatments or biologics or conservative care products, and you have, something here that's going to allow for you to add all those things, add hard code, the HIPAA codes. So the system knows you're going to have the lot number, the expiration date, and now you can manage those things inside of the clinical workflow. So when this is present in the system, you're going to turn around, or the clinician's going to turn around when they're in the visit. They go to the advanced treatment section, and then all of their skin graft or what substitutes are going to be built into that advanced treatment. They can select it, take a picture of the box, and then that becomes your tissue, or this becomes your tissue log right here. So this would roll up to what's called the used inventory. Inside your used inventory, you're going to have the ability to see the product that was used, the lot number, the expiration date, the provider, the patient ID, and then you also have the date that it was used, the areas of that was used, and the amount that was wasted. All of this is being collected, and then you also have your billing status as well for this graph. Now, the beautiful thing about having this is when you come in here and your accounts receivable, or the person who's paying everything, right? They're gonna know what the status of that graph is, right? That you want them to know, like, hey, we got it, so it's a big issue.
Every platform we've used since we've started, that is a nightmare.
Yep. The billing.
It's ridiculous. Like, she spends hours and hours a day tracking it out. Well, was this bill? Well, it wasn't billed out. Well, why wasn't it billed out? Well, because the didn't put the right amount of square centimeters, and she's constantly having to update. It's ridiculous. And we have these outstanding bills because we find out that the biller didn't bill it, and then she's trying to pay these invoices and reconcile them, and it is, I kid you not, it is a whole crap show.
Exactly. That's what, so see, I love you because you understand.
Dude, my person is my mom, and she was an accountant for the Chickasaw Nation for 40 years. And this is like, she said, Carrie, in all my days there, I have never wanted to punch people so bad in my life. But it is like, how hard can this be?
It is. Like I said, everything I've done is because I sat down with every single person in operations, and I sat there and listened to every gripe that they had. And I was like, there's no way. You should not have all of these systems dispersed. Everything needs to be in one box.
People doing 5 different things, and there's so much crossover. Like, the way we have the schedule right now, they think moving to Microsoft Office is going to fix our scheduling problem. It's not. It could be a prettier crap show.
Exactly. And it's funny you said that, because when that board, I'm sorry, I gotta stop just to tell a story, because it's so funny you just said that, because that is what the provider called me and said. I just got Microsoft. I need for you to come in and take the Microsoft and like get us all organized. And I'm like, dude, are you kidding me? Like, that's not. When I got there, I actually did some stuff for him in Teams, and I literally said, bro, this is not gonna solve your problems. And then that's when I proceeded to build this. Anyway, I just want to tell that's so funny.
It's nuts, because like if you all of the ones I've demoed, I'm so far very impressed.
So this right here is your receiving, so you can receive stuff. Now, the cool thing about my system, right? It's a one in the advanced, it's 1-to-1. So what do I mean by that? You can attach your par level, so you can go in, you can select the product, and then you basically set your par level. So it then tracks when they're down to a certain level, it'll send an alert that, hey, if it's like a product that you have on consignment that they can use.
Don't use any consignment products if that's
okay. So you don't got to worry about that then. I've created workflows. Now, this is a cool thing that you might like. This is called my advanced treatment recipes. It's workflow recipes. Now, what I've done is I've made it so that you, as the person who's really smart and have a lot of experience, can go in here and you can literally build out figurative cases and ranges of wound sizes and types of wounds. And then you can say that this is the protocol for those. So what happens is when they go in and they start the treatment, if those things are present, it will then say, this is what your medical director suggests you do with this case, right? So this makes it so that things are really streamlined, and then you can get new people or new folks coming in and doing stuff and being more proactive and more engaged right away, right? And without them having to call you all the time, right? That's a big thing as well. So this is the inventory section, inventory system, which again, is a big part of what we do because it keeps everything connected. And then the conservative care products is a little different. It's basically you just put in all of the other stuff that you want to be like, scissors or bandages or whatever the case may be, okay? Then we also have our oversight cockpit where you have all of your financial stuff, your financial performance, clinical workload balancer, which allows for you, let's just say that you have it set up where you have 20 clinicians and they're all loaded up, right? You've been needing to hire 5 new clinicians or providers, and now let's say you hire 3 more, and you're trying to figure out, how do I move all the patients around to make sure that the staff stays efficient? I have an AI module that goes and looks at where all patients are at, looks where all the providers are at, and then it will give you an option to reshift and recalibrate the workload of everyone instantly without having to do a clear audit into every single day, every single person, every single thing, right? So we put things into place that's really going to help you as an operations person, okay? What else do we have? Oh, we also have internal chat. So your team can chat, whether it's like just between each other, or you also have the ability to chat at the patient level as well. So if you need to chat with other team members, that's all built inside of the system, and it's all HIPAA compliant.
How does that work? So like right now we use Ring Central for all of our phone calling, and I feel like it's the least expensive of lesser expensive of many options, but we also fax from there. Is that a type of a feature that's in here to where it pops on their app if they're out in the community? If the provider's out seeing patients and they need to communicate with the girls in the office to do XYZ, is it communicating within that app? Because the girls in the office obviously are going to be on their computers, but you have this open working on it, this behind the scene.
Yeah, that's a good point. Yeah, so basically what happens is it's all in the app, right? So you go in here, you basically are able to chat right in front of in the system with your whole team members. When they get a chat, it basically get an alert, just like with any other app. They'll get their alerts. And then we're actually working on something where they can set it up where they want to get a text message whenever somebody kind of sends them something inside the app, so they can have that real time. But you also have the ability to get that alert inside the system, go back into the system, and then reply. Okay. Now, this right here is one of our last. And just let me back up a little bit just so I can answer this, because I don't know if this will add a little bit of clarity into things as well. You can still have your Ring Central, but we also have our own smart fax lines that are built into the system. So when someone sends a referral or documentation, all of that is automatically injected into the system for you. And our smart system actually has the ability to read what's on those faxes, and then we can set up different custom route around, if it's a referral, or if it's this or if it's that. Does that make sense?
Yeah.
System will basically keep all of the stuff in order. So instead of you going into like one of these e-faxes where it's all just being dumped in e-fax, and then it takes you like 3 days to go through all the faxes because people dump you, right? You're going to have more, this system is going to have more context to know where that documentation should go, okay? This right here is the billing and claim section. You will have a built-in billing apparatus where you can submit the visits. So when those are brought in, if you have your own biller, you can download the 1500 form and then send that to them directly, or you can do it through our system as well, where you can just here and just send them the billing.
Could we possibly give them just to access their own login?
Yeah, that is exactly right.
Yeah.
That's exactly right. So you go in, we create a user for them, and then they're able to come into the system and then process all of the insurance and all the information. So this is basically how that comes in. And then we also have an API that we can use that will connect to Claim MD, and then you can also submit it that way as well. Now, another thing, I didn't talk about this too much, but you also have all of your IVRs forms also built into the system. So like when you go into the patient and let's just say they are ready to submit that, we have all of these custom IVR forms, whatever the clinic uses, they come in here, list the IVR form that whatever their provider uses, we build that in, and then this is automatically submitted, and we pull all the information that's pertinent out of the system into this form.
Okay. So basically everything is here. Just a question, Carrie. When it comes to the completion of the documentation right now with your providers, what's your timeline? Like 24 hours, 48 hours?
We give them 48 hours.
But is that met? I know. I've been in the practice as well.
Doctors are pretty good. The only days, if they have really long days and they have a really, most of them get it done because honestly, we do our assessment by the app and then they still have to go on the backside to finish because there's just some things that only the app itself will capture. But most of we have pretty good compliance on getting their documents done.
Here is Medipyx.
Our gap right now is our biggest gap, to be honest, is scheduling and then getting the wound care order. If the note's not done, just getting the wound care order updated and out to the home health agency so that the next time they go out, they have a current order. Those are really where the pain points are. And honestly, being able to, the tool to be able to go in and look, because I feel like there's a handful of our providers that just, even though we are not a very graph forward company.
Yeah.
I love the idea of you guys, of an AI being able to help us track that out, because I literally have to go in and say, hey, this patient, they're yellow. They've been yellow for 2 weeks. And that means that, they haven't improved for a certain number of weeks. What, have you considered grafting them? And, oh, well, yeah, but I really wasn't sure. And so that's a pain point for us, for sure. Like having that critical guidance going directly to that provider versus me having to spend the rest of today and tomorrow going through their patient load and saying, hey, why aren't you looking at trying to, they've stalled. They really have stalled. You've been to Readiness, we've done Healwell gel, we've done collagen, we've addressed exudate, we've done everything we can do. This patient would be a candidate for a cellular tissue product. And so that takes the burden off of me.
Exactly.
And another thing here, during your initial evaluation, in the part where you capture the previous treatments in Medipyx, once there is a part there in which it will ask you if the patient already exhausted the conservative treatments. Now, if those are all ticked, it will give you an option that leave graft, miss therapy, and PRP alone. And then once you click on graft, it will give you a green light that your patient is graft eligible based on the requirement that the patient has exhausted conservative treatment. When you go down there, there's like a tick box there to check medical necessity and the checklist that you need to comply for a patient to be eligible for grafting, like infection-free, 100% granular, no osteomyelitis, if the patient is a smoker, at least completed 2 weeks of cessation. All of that can be checked as you go on the visit, and then until it will tell you that your patient is ready to go for grafting. So that's an added feature in there that will help providers identify that, oh, we can graft this patient. And another thing there is when you are on the last part of the documentation, you won't be able to add a new visit on your next visit unless the provider completed the attestation.
Okay.
So in 24 hours that the provider completed the documentation and you did grafting and other procedures, you can bill right away, right after, once the documentation has been completed. So, yeah.
Cool. So what I want to do is we're going to spin you up a demo environment where we're actually in the process of putting like some